A medical problem rarely happens at a convenient time. It might start late at night, during a weekend, while traveling, or when medical services are temporarily unavailable. In those moments, many people face the same question: what should you do when you need medical guidance but cannot reach a doctor? For most situations, the goal is not to replace professional care. The goal is to stay calm, observe the situation carefully, and make practical decisions until proper help becomes available. Many health concerns start with uncertainty. A symptom appears, but it is not immediately clear whether it is minor or something more serious. When a doctor is available, the next step is usually simple: call, schedule a visit, or go to urgent care. But when that option is not immediately possible, people often feel unsure about how to respond. Some individuals ignore symptoms and hope they disappear. Others panic and assume the worst. Neither reaction is particularly helpful. A more practical approach involves understanding a few basic steps that can help you evaluate the situation and respond in a safer, more organized way. The first step is simple but extremely important: slow down and assess the situation. When symptoms appear suddenly, stress and anxiety can make the situation feel more severe than it actually is. Taking a moment to observe what is happening helps bring clarity. Ask yourself a few basic questions. What exactly is the symptom? When did it start? Is it getting better, worse, or staying the same? Are there other symptoms appearing at the same time? These questions are similar to the ones medical professionals ask when evaluating a patient. By thinking through them calmly, you begin to create a clearer picture of what might be happening. The second step is recognizing warning signs that require immediate emergency attention. Certain symptoms should never be ignored, even if you cannot reach your regular doctor. Severe chest pain, difficulty breathing, sudden confusion, loss of consciousness, uncontrolled bleeding, or signs of stroke are all examples of symptoms that require emergency services. In those situations, waiting for a regular appointment is not appropriate. Emergency care exists specifically for these types of problems. However, many health concerns fall somewhere between minor discomfort and a clear emergency. A moderate fever, persistent headache, stomach pain, or unusual fatigue can leave people unsure about what to do next. When a doctor is not immediately available, observation becomes an important tool. Pay attention to patterns. Note when symptoms appear and whether they change with rest, hydration, food, or time. For example, mild dehydration can cause headaches, dizziness, and fatigue. Drinking water and resting may improve symptoms relatively quickly. Similarly, minor digestive discomfort may improve after eating lightly or avoiding certain foods. This type of observation does not replace medical care, but it can provide useful information that helps guide your next steps. Another useful approach is reviewing basic health resources that provide general information about symptoms. Reliable public health organizations often publish symptom guides designed to help people understand common warning patterns. These resources do not replace doctors, but they can offer context when immediate medical advice is not available. In addition, many communities have telephone health advice lines or telehealth services where trained professionals can offer guidance. Even when your regular doctor cannot be reached, other medical professionals may still be able to provide basic direction. Another important step is documenting symptoms. This may sound simple, but writing down what you are experiencing can be extremely helpful. Record when symptoms started, how they feel, and any changes you notice. If you eventually speak with a doctor, this information allows them to understand the situation much more clearly. Medication use is another area where caution is important. When someone cannot reach a doctor, they may be tempted to experiment with medications in the medicine cabinet. This can create additional risks if medications interact or if dosages are unclear. When using over-the-counter medications, it is important to follow labeled instructions carefully and avoid combining multiple drugs without understanding how they interact. Sometimes the safest choice is to wait, observe, and seek guidance as soon as possible rather than attempting to solve the problem immediately with medication. Another practical step is preparing in advance for situations when medical care is harder to reach. Many people do not think about this until they face the problem. Keeping a small record of important health information can make a difference. This might include a list of medications, allergies, previous medical conditions, and emergency contact numbers. Having this information available helps if you need to contact emergency services or speak with a healthcare professional later. The key insight in situations like this is that most health problems do not require instant decisions, but they do require careful observation. The body often provides signals that change over time. Watching how symptoms evolve can provide valuable clues about whether the situation is improving or worsening. For example, a mild headache that improves after rest and hydration is very different from a headache that rapidly becomes severe and is accompanied by confusion or vision changes. Similarly, stomach discomfort that fades after several hours is not the same as severe abdominal pain that continues to worsen. Understanding these patterns helps people respond more thoughtfully rather than reacting purely out of fear or uncertainty. It is also important to recognize your own limits. Self-observation is useful, but it has boundaries. If symptoms are unusual, severe, or persistent, seeking medical attention remains the safest option as soon as it becomes possible. The goal is not to replace doctors, but to bridge the gap between the moment symptoms appear and the moment professional care becomes available. Health situations are rarely predictable. Clinics close, travel disrupts routines, and unexpected symptoms appear when help is not immediately accessible. Having a basic framework for responding to those moments can reduce stress and lead to better decisions. When people understand how to observe symptoms, recognize warning signs, and document changes, they are better prepared to communicate with healthcare professionals once contact becomes possible. In many cases, these simple steps provide reassurance that the situation is manageable. In other cases, they help identify when a problem needs urgent attention. Both outcomes are valuable. If you find practical explanations like this helpful, consider subscribing to the channel. The goal here is to break down everyday health situations into clear and understandable steps. You can also check the description, where there is a helpful resource that organizes several practical health response guidelines. It can be useful if you want to review the ideas discussed in this video or keep a simple reference available for future situations.